Hey guys, we are here today at Brookwood Baptist Medical Center to introduce our first Facebook Live presentation during Heart Month. And we will be covering lots of different topics that our patients are currently facing. Today we will be interviewing Dr. William McAlexander, a cardiothoracic surgeon who has an interest in atrial fibrillation. Dr. McAlexander is an engineer by training and practices all aspects of heart surgery. Today we will discuss a frequent malady to many Americans, which is atrial fibrillation. Dr. Mac. Move over to you.
Good morning. I hope everybody enjoys this. The goal is to educate whoever is watching, answer questions at the end, and discuss a little bit about a topic of heart surgery that I'm very interested in. Most importantly, the fact that it's treatable and we can improve people's quality of life as well as reduce some of the medicines they're taking.
Great.
Laura, thanks for setting this up.
Absolutely. So, first question on deck is, what is AFib?
Laura, atrial fibrillation is a condition where two chambers of the heart do not beat in synchrony with the other two chambers. They beat irregularly, and this can cause symptoms, but most importantly, it can cause blood clots, and blood clots can cause strokes. AFib is a treatable condition, and its effects can be mitigated with medicines as well.
Great. So how common is AFib? How many diagnoses are we talking about?
Laura, between 30 and 40 million people in the world have AFib. Over 5.5 million Americans have it. Close to 500,000 admissions in 2017 alone were related to AFib. And the cost of AFib in this country for healthcare is in excess of $6 billion with a B dollars. A lot of that comes from the complications of AFib, but a significant portion is from its treatment or the medicines to prevent its side effects.
And if I have AFib, what are my symptoms? What am I walking around with every day?
You're walking around with an irregular heartbeat, and sometimes patients, or sometimes you would be able to perceive this as palpitations or your heart's racing. It's basically an irregular heart rate. Sometimes you have no symptoms. Unfortunately, the first symptom on some people's case is a stroke. People who have AFib are at a much higher risk for stroke. Bottom line, go see your doctor for regular checkups. In those regular checkups, your doctor will assess you for a regular heartbeat and the conditions that are associated with AFib. Basically, 1 in 10 Americans over the age of 65 have AFib. If you're in that category, if you have high blood pressure, diabetes, heart disease, and some other medical conditions, you're at risk for it. And like all doctors advising our patients what to be looking out for, what risk you're in, if you're in the risk category, check it out.
Great. So, speaking of risk, who is at risk?
People who have heart conditions like hypertension, who have diabetes, who have congestive heart failure. Women are higher risks than men. As we get older, we're at elevated risk for AFib and the conditions that can lead to AFib. Basically, as we develop a need for health care, we develop a risk for AFib.
What are the different treatment options if someone has an AFib diagnosis?
So the 4 types of AFib can be broken down into those that can be treated and those that can't be treated in the past. Nowadays, all 4 types of AFib can be treated. When I say treated, I mean cured. A lot of the treatment for AFib in America is prevention of the side effects of AFib, or the preventions of stroke, or to try to convert somebody to a regular rhythm. And those medicines that we have traditionally treated AFib with have side effects. And some of the newer treatments and some of the newer attempts to cure AFib is a goal to improve the quality of life and to get you off the medicines. But the treatment for AFib is either medicines, shocking the heart into a normal rhythm, a surgical correction of AFib, or a catheter-based correction for AFib, like a cath, Laura.
Got it. So I understand that AFib can increase the risk of stroke. Is there anything that I can do to minimize the risk of stroke?
15 to 20% of the strokes in America are related to AFib. That's an enormous number of Americans. The more scary number is if you have AFib, you have a 5 times rate of having stroke. In other words, your rate goes up times 5. And it's a tremendous condition that can be treated. Through the thinning of the patient's blood, we can minimize the strokes, but by thinning people's blood, we introduce the risks of bleeding, and it's not a complete prevention for stroke. The goal to prevent stroke in AFib is to treat the AFib, get the heart into a normal rhythm, and then treat the places in the heart that the blood clots come from, like the left atrial appendage, for instance. Dealing with the left atrial appendage removes the point where 90% of strokes occur. These strokes occur from the left atrial appendage because it doesn't squeeze normally in folks that have AFib.
Can you talk about some of the benefits of treating AFib versus the risk of not treating it?
So the risk of not treating AFib, obviously, as I discussed, is stroke. Decrease in your physical ability because your heart's not beating the amount of blood it should beat in a normal cycle. Treating AFib and getting off medicines is beneficial, not only for cost, but for the side effects of the medicine. The mainstay of the medical treatment for AFib is blood thinners. And blood thinners, while they decrease the risk or the rate of stroke, they introduce a whole new risk, and that is bleeding. None of the treatments of AFib is free of risk. The invasive procedures, while they're minimally invasive, they do offer some elevated risk, but the medicines themselves, treating the symptoms, offer risk as well. Bottom line, if you have AFib, nowadays it can be treated and hopefully convert you to sinus rhythm.
Great. All right, we're going to take some questions from our Facebook followers. Kimberly, what's the first question?
The one question we have is, what can I do as a 30-year-old female to prevent AFib in the future?
Prevention of AFib is difficult. Stay healthy, stay active. Good heart health is the mainstay of keeping yourself from getting heart conditions. Lowering your cholesterol, regular exercise are all very important. Occasionally people get irregular heart rates or AFib from from consumption of things that are stimulants. Caffeine is the #1 stimulant in America, and high doses of caffeine have led to irregular heart rates. Chocolate contains a stimulant, and I know it's Valentine's Day, but Kimberly, if these 30-year-olds could minimize their consumption of stimulants, irregular heart rates will go down, and the leading to AFib will get better.
Great. I think that is all the questions that we have from the audience. We appreciate you being here today, Dr. McAlexander.
We have one more question.
Oh, one more question.
Dr. McAlexander, can you explain the surgical treatment for AFib? If you have AFib, what are the options surgically?
So the surgical options are first in the cath lab, where a cardiologist will put a small needle into your groin, go up inside your heart, and work on the wires of your heart. AFib is a short circuiting of the wires in the heart, and with a catheter they can attempt to fix that short circuit. In folks that have had AFib for a year or two, occasionally an additional procedure, a minimally invasive procedure with a small incision, can assist the cardiologist in fixing those wires, and that's a combined procedure between a heart surgeon and a cardiologist. All these techniques are very successful, and in the last few years in the AFib that we thought we couldn't treat, who had been present for a long amount of time, we're seeing some success in adding these extra procedures.
What does the recovery look like for a surgical ablation for a patient?
A catheter ablation is a 1 day in the hospital. A surgical ablation is a 1 or 2 days in the hospital. Both you take some Tylenol to recover, and you should be in a normal rhythm and should stay in a normal rhythm as soon as you get out of the hospital.
Great. Dr. McAlexander, can you tell us a little bit about your practice here and anything outside of the procedures we've discussed that you guys do here?
Here at Brookwood, we have a full offering of all the procedures to treat AFib. We can place plugs in the left atrial appendage. We can surgically place a clip on the left atrial appendage. We can do procedures for catheter ablation. We can do the convergent procedure, which is the combined procedure between the cardiologist and the surgeon to treat AFib that's been going on for 10, 15, even 20 years. And that's important that I want to get across to everybody. Is just because you've had AFib for 10 years and your doctor has said in the past there's nothing that we can do, the newer treatment options can treat and even help people who've had AFib for a long amount of time.
Great. We've got one more question from the audience. Are certain people more susceptible than others to stroke or AFib?
People who do not take blood thinners who have AFib are susceptible to stroke. People who have high cholesterol and have other conditions like high blood pressure can develop conditions that can lead to stroke. Stroke can be caused from many different things, but regarding AFib, if you have AFib, you have a 5 times risk of increase in stroke. Treating your AFib, or at least preventing the heart from beating abnormally or not thinning your blood, are ways to mitigate stroke.
Great. I think that's all the questions from the audience. To all of you, the slide deck that you've seen over Dr. McAlexander's shoulder will be posted to Facebook following this feed. If you have questions or want to follow up with a physician, you can reach Dr. McAlexander's office at 205-877-2677. Dr. McAlexander, thank you so much for doing this for us today. We appreciate it.
Thank you, Laura, and I hope everybody gets their AFib looked at.